Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, March the 3rd, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon and thank you, Brad. And before I deal with the health-related situation, I would like to just say a few words about the conclusion of the court proceedings in respect of the Yonge Street tragedy today. Today, Superior Court Justice Anne Malloy has delivered a guilty verdict in the murder of 10 innocent people in our city and on all 26 counts in the indictment related as well to people who were injured. While there will never be complete closure for the families of those who died, those who were injured, or for the city itself, the conclusion of these proceedings will help, and Justice Malloy deserves our profound thanks for her handling of a very difficult case. My focus today, as it has been every day since this terrible tragedy took place on Yonge Street, is on those 10 innocent people who lost their lives, on the 16 innocent people who were injured, and all of the friends and the families and the bystanders and the first responders, many of whom I have met with on your behalf since that time, because their lives were forever changed by this tragedy. Since that day, we have been working hard as a city to help the survivors to heal and to move forward and to support the families as they continue to mourn their loss. I truly hope that for the victims and their families and friends, today's verdict will help them. Nearly 3 years ago, our entire city was rocked by this heinous act of violence right in the heart of North York. I want those who continue to be impacted by this tragedy to know that Toronto is with you and that we all continue to support you. We will remain forever grateful for all of our frontline heroes, police officers, paramedics, firefighters, and special constables who responded to help people that day, and all the bystanders who provided aid to those people who were suffering in those terrible moments. I also want to thank the Toronto Police Service for conducting a thorough, comprehensive, and very professional investigation that helped to lead to this verdict. Make no mistake, this was an attack fueled by misogyny and hatred of women and should be regarded as such. We must all stand up against this kind of hateful behavior and those who promote it. Today, I want to remind residents, because this is the most important thing of all, I want to remind residents of the names of those lives lost, which bear repeating so that we will never forget them. Renuka Amarasinghe, Andrea Braden, Geraldine Brady, Anne-Marie D'Amico, Sohee Chung, Betty Forsyth, Chulmin Eddie Kang, Ji-Hun Kim, Munir Najjar, and Dorothy Sewell. In the wake of the attack, we vowed that we would stand together as a city to support them and their families, but also to support each other, strong and united against the evil that we saw that day. We vowed that we would not be broken. So let us renew that vow today and go forward committed to protecting one another and doing everything we can to make sure that a tragedy like this never happens again. Now, turning to COVID-19 and health-related matters, today Dr. Davila will be laying out her view for moving Toronto into the gray zone next week. This move would follow extensive, detailed, and constructive discussions aimed at producing the right overall result for Toronto. I believe this is the right approach, and it is based on the public health advice we've relied on throughout this pandemic to save lives and to protect people, but also on a number of other important considerations we must take into account, as we've done throughout with respect to the overall health and well-being of our entire community. The cautious transition is the right way to go, all things considered, but public health does believe some additional workplace protection against this virus is called for, and I support that as well. And in trying to assist in that regard, my office has reached out to the Ontario Minister of Labour, Monty McNaughton, to help support this move with increased workplace inspections over the coming days, and we have received a positive response in that regard. All of this taken together will ensure that we proceed with caution to begin to reopen and stay open while we move ahead with vaccinations. Those vaccinations, taken together with regional and economic realities, make it the right time for Toronto to move cautiously back into the provincial framework, a move which I support. This recommendation comes after more than 3 months of lockdown measures. I want to thank the vast majority of Toronto residents and businesses for their patience and their sacrifices. The second wave and the resulting lockdown was in some respects more difficult than the first. We have made progress in stopping the spread of the virus, and we have been careful as the variants of concern have started to surface. It is our hope, our very sincere hope, that this cautious approach will take us moving forward and will protect the gains we've made and help ensure that we do not have to contemplate another shutdown, something we have been seeking to avoid as a worst-case scenario. And this change will happen as we anticipate receiving more vaccine supply from the Government of Canada and ramping up our efforts to help the provincial vaccine rollout. The vaccine, and everyone who is eligible to receive their vaccination, will help us ultimately to stop COVID-19 and keep moving forwards towards a broader reopening. We have focused on 4 areas during our discussions around next steps. 1, public health. It is obviously the highest priority consideration given that a healthy economy needs healthy people, and it is our obligation to safeguard and protect the health of our people. 2, the regional and provincial perspective. We've worked best in confronting the virus when we've had a more consistent approach across the GTHA and the province. It is easier for people to understand as they move between municipalities if the rules are similar. And we know that a lockdown in one area alone is largely unsustainable for a longer period. Toronto is not an island. Third, the behavior and mindset of people. This has been a concern throughout the pandemic, and I do want to thank people for their determination to follow the rules and get through these tough times. I know it has not been easy, and people are ready to move forward, provided that it is safe to do so from a health perspective. Fourth, jobs and the economy. The continuing impact of the pandemic on jobs and the economy has been a significant concern throughout the pandemic, and we have worked to help protect jobs and businesses by advocating for the unprecedented supports that have been offered for people and for businesses by the other governments. Doing what we can as a municipal government and trying to make sure that we weren't walking into a third lockdown by ending the second lockdown too early have also been priorities for us. With all of these 4 areas in mind, the decision to move into grey in the coming days makes sense. I've already initiated discussions with the city government about what it will take to see us safely continue to progress through the framework as circumstances permit. These discussions will both ensure that we continue to be focused on the health and other requirements of continuing to move forward, but also to make sure that we are ready to move forward when the time comes. I am very confident that we can move forward out of the stay-at-home order that we've been under since Christmas, and I believe that this approach, taken in a manner consistent with public health advice, will give us our best chance to move forward into the other framework zones and continue along a path which leads to a return to a more normal life as it relates to work and to play and to just living lives here in the City of Toronto. On that note, I will ask Dr. Davila to present her remarks for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 290 new cases of COVID-19. 285 people are in hospital, and 62 people are in the ICU. I'm sorry to have to report, as well, an additional 5 deaths. 1,468 cases have screened positive as likely variants of concern. We have 126 cases that have been confirmed as variants following laboratory testing. 122 are the UK variant B117, 3 are the Brazilian variant, and 1 is the South African variant. The variant figure is not what I want to see. A week ago, the screened positive number was 710. So in a week, the number of cases screening positive for a variant has more than doubled. I have said throughout the pandemic that I am guided by the facts as they are. I have never decided easily to recommend restrictions for Toronto. I understand that each course of action comes with benefits and costs. Overall, Case counts at present call for a cautious approach that will allow us to reopen and to do so as safely as possible. Based on the data in front of us, it is clear that reopening widely, such as under the red category of the provincial framework, is not advisable at this time, given our current case counts. Moving out of the stay-at-home order is a reasonable course of action for Toronto. Although I will add that while there are evident reasons for a change in status, there remain reasons or risks that underscore how moving back into gray status is and will be a delicate balance. It comes down to our choices in our daily lives. Our ability to make the right choices is the reason a move in this direction is possible. While I believe moving into gray is reasonable, we are also scaling up enhanced safety measures to protect those essential frontline workers who have been disproportionately impacted by COVID-19. The people, the employees, and the businesses of Toronto have earned this change through their commitment, often at a personal sacrifice. The businesses that closed in Toronto to help limit the spread of COVID-19 were closed ahead of so many others in other parts of the province. And my honest belief is that by shouldering that burden, Toronto helped Ontario to limit the spread across the province. Returning to the province's framework represents a modest step toward more flexibility in daily life, which can be taken because we've all worked to limit the spread of COVID-19. It is important we now act in ways that do not squander these hard-earned small steps forward. In that respect, I am issuing a new Section 22 order for workplaces in active outbreak, with requirements aimed at shoring up the gains made in the past many weeks and offering protections for people on the job. The order requires businesses to ensure the use of masks by every person in the workplace at all times for the duration of the outbreak, to follow Toronto Public Health's instructions pertaining to the investigation of the outbreak, to ensure distancing and reduced capacities in shared spaces at the business, to have a designated contact person for Toronto Public Health to work through during the outbreak, to maintain records of every person entering the workplace, to comply with infection prevention and control measures and post signage about physical distancing, hand washing, and mask wearing. Like the measures we all undertook in the last weeks and months, these measures for workplaces will have a beneficial effect on our efforts to gain control over COVID-19. While these requirements apply only to workplaces in active outbreak, I'm asking all businesses in Toronto to show their support and implement these measures because they're not in outbreak, to take steps to prevent winding up in outbreak. The province has also agreed to do a proactive enforcement blitz on workplaces based on the history of health risk we've observed in these settings throughout the pandemic. We've seen the results when everyone is working toward the same goal. We are on the cusp of taking a much-wanted step toward a little more flexibility in our daily lives. But, and until we've brought COVID-19 well under control, there must always be a but. But the steps for self-protection are more valuable and vital than ever. It's now a question of preserving what we've gained. The case counts are down, but the variant cases are up. What may be possible can only come from a continued decline in cases, from arresting the spread of the variants, from delivering vaccinations, and from continuing, for now, to stay at home and stay apart as much as possible and in as many ways as possible. To preserve new flexibility, we need to continue to act in ways that sustain it. With that, I'll now hand it over to Chief Pegg.
Thank you, Dr. Davila. Good afternoon. The city's immunization task force continues to be hard at work, ensuring that we're ready to open city-operated COVID-19 immunization clinics as very soon as vaccine supply permits. There are 14 COVID-19 immunization clinics in operation today by our healthcare partners, with each clinic putting needles into the arms of eligible recipients as established via the Provincial Prioritization Framework. Several of our hospital partners are using their available vaccine supply to vaccinate people 80 years of age and over, particularly those who regularly attend the hospital for healthcare services. Our most recent data suggests that more than 36,000 vaccines have been administered to Toronto residents over the age of 80. This effort is continuing daily as vaccine availability permits. I want to assure everyone that we are working nonstop to ensure that we are able to get people vaccinated as very quickly as possible. That will happen as very soon as vaccine is made available by the Government of Canada via the Province of Ontario in the most efficient and effective means possible. We are continuing to prepare the network of 9 city-operated immunization clinics for operation. At present, 5 of these sites are prepared, and the setup work is ongoing for the remaining 4. Based on the most recent information from the province, we are planning for the arrival of increased quantities of vaccine in late March, and then on a go-forward basis thereafter. Our plans are continuing to be implemented in accordance with these assumptions, and we will be ready to launch city-operated immunization clinics as very soon as vaccine availability permits us to do so. Since the arrival of the first vaccines in Ontario, and as of last week, a total of 195,370 doses of COVID-19 vaccine have been allocated for administration within the City of Toronto by the Province of Ontario. This is comprised of 137,670 doses of Pfizer vaccine and 57,700 doses of Moderna vaccine. All but 2,000 of these doses have been allocated directly to and administered by our healthcare partners. Our Toronto Public Health team estimates that there are approximately 325,000 people to vaccinate in Toronto in accordance with Phase 1 of the provincial framework. We remain committed to ensuring that every single dose of COVID-19 vaccine is administered in as timely a manner as possible. Once we have received the required supply of vaccine via the Province of Ontario, we will commence with city-operated immunization clinic operations, which will further support the acceleration of immunization operations across the city. As we have outlined before, city-operated immunization clinics will leverage the provincial scheduling system that is presently being pilot tested in a number of smaller jurisdictions across Ontario. Once this system comes online for Toronto, residents will have access to a public-facing online registration and booking system. The online system will also be supported and augmented by telephone-based support via a provincially coordinated call center. When booking COVID-19 vaccination appointments, clients will be required to verify their personal information and their eligibility for vaccination in accordance with the provincial eligibility framework. Once confirmed that the client meets the applicable eligibility criteria, they will be provided with a unique registration code that will enable them to securely schedule their vaccination appointment. When booking their appointment, each client will have the ability to select an available clinic location and will be able to select their preferred appointment date and time based on availability. This system automatically populates the required scheduling information within the COVAX ON system, which is the province-wide system that we utilize for managing clinic operations and vaccination record keeping. We are continuing to work every day with our provincial partners to ensure that we are able to make vaccinations available to everyone who wishes to receive one as very soon as possible. Once again, I ask that residents not call 311 nor the Toronto Public Health Info line to inquire about booking COVID-19 vaccine appointments at this time, and that they not attend any of the clinic facilities until such time as they have a confirmed appointment. As vaccines become available, information will be shared about prioritization and how to book an appointment. The arrival of additional vaccine is on the horizon. I thank everyone for their continued patience as the situation with vaccine availability continues to evolve. And I continue to encourage everyone to monitor toronto.ca/COVID-19 for the most accurate and up-to-date information relating to both COVID-19 response and vaccination in Toronto. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to our reporter friends to please unmute yourself so we can hear your question. We'll go first to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. To Dr. Davila and to Mayor Tory, first, I'm just wondering, when it comes to Peel Region, their regional council had voted last week to unanimously request to go into the red zone. And to Mayor Tory, I'm wondering what kind of conversations you have had with that region, considering the fact that you're in favor of going into the gray zone. And to Dr. Davila, where you and Dr. Lowe are now recommending going into the red zone, or sorry, getting mixed up here, the gray zone. I'm just wondering how you have been both approaching this decision together.
I'll say for my part, I talked, of course, not to the medical people, but to the elected representatives, the two mayors, Mayor Brown and Mayor Crombie, and indicated what direction in which we were likely headed, indicated that it was unlikely that we felt our situation, which is not that dissimilar from theirs, would allow us to go to the red zone. They had their own set of discussions with their own medical officer of health, and the result is what you see him saying today. And I think that, frankly, this consistency as between Peel and Toronto is desirable. I think it would have been even more desirable to have more consistency across a lot of places, because you get people moving around a lot, but we are where we are, and those discussions with the Peel mayors were very constructive and very positive, and you've seen where we've ended up.
And for my part, Matt, with respect to Dr. Lowe, we've had conversations with Dr. Lowe and his team throughout the course of the pandemic, as you can well imagine. And as the mayor has indicated, our situations are not that dissimilar one from the next. So certainly, I feel quite confident, speaking for both Dr. Lowe and myself, that we're watching the data carefully, and that what we see in our discussions and what we have put forward is a cautious approach that considers the data in front of us, that looks at the circumstances on the ground, and also takes into consideration how do we move forward in as safe a fashion as is possible. Whether we're talking about Peel or Toronto, these are our primary concerns. How best do we preserve public health overall for our respective jurisdictions?
Matt, I'd just like to say one more thing. This is obviously a recommendation going forward, which the province will have to approve. And I want to say, I'm very sympathetic to those who would not be able to open going into gray, but I think that the best way in which we can avoid that further lockdown later on, which I think everybody, to a person, says would be the worst case scenario, is to take these cautious steps one at a time and to follow public health advice, to keep doing what we've been doing in many respects, and then the day may not be too far down the road where we can do more, but that doing it in this way, I think, is the best insurance policy we have against a future lockdown, which I think everybody has no use for and no interest in.
Thank you for that. And again, to you both, I'm just wondering, when you look at other jurisdictions where that emergency brake has been put in place, how much did that experience in those areas? I know, Mayor, you've spoken repeatedly about not wanting to go into another lockdown after just getting out of one. How much did the experience of watching other jurisdictions get placed back in that help inform this decision?
Again, I'll just say for myself that the best interests of the City of Toronto were what was on my mind all the way through in my discussions with Dr. Davila and everybody else, and that you have to put that into the context of the region and the province and what's going on, into the context of the mindset of the people, into the context of jobs in the economy and trying to help out there, but most importantly, first and foremost, within the context of public health and what is going to keep people healthy. But you watch what's going on elsewhere, but we have our own situation to deal with here, as we have from the beginning. But we're not an island. We have to take that into account, but we have our own best interest to take into account.
Yeah, so Matt, I would echo exactly what the mayor has said. First and foremost, the concern and consideration is around what we're actually seeing here in Toronto and what makes the best sense to preserve and protect the health of Torontonians. Doing that, though, of course, needs to be informed not only by our local data, but that which we see elsewhere in the province, and certainly other large jurisdictions around the world that have had similar circumstances. What their experience has been, obviously has been taken into account and is taken into consideration with each decision that we make. But first and foremost, it's about what makes sense for Toronto.
Thank you. We'll go next to Jason Chapman from AM 640. Go ahead, Jason.
Hi, Brad. Thanks for the question, guys. I'm going to piggyback on a bit on my colleague Matt's question. I appreciate you saying that you want to be respectful or follow public guidance and what's allowed to open and what's not allowed to open. But I want to really sink into two areas. Gyms and hair salons or barber shops. They're not going to be allowed to open under gray. And I just want you to explain to those business owners who have spent a ton of money fixing their shops, changing their shops and gyms to make them safer. What data are you using? Because I don't think we've heard this through the whole pandemic, to say you can't reopen even with all the safety measures that you put in place. What data are we relying on for that decision?
So, Jason, with respect to what is allowed to happen within the different levels of the provincial COVID response framework, those are questions that really should be best directed towards the province. I would say this, though, and the mayor has already made comments to this effect. What we're seeking to do here, certainly within the context of Toronto, is to, one, first and foremost, protect the health of the residents of this city. And yes, that does include, employees or owners of businesses. But we know that businesses are successful. What makes a healthy economy is healthy people. I think the other piece that was very important in the remarks that the mayor made, and certainly I think are important in answering your question, is that what we're promoting here is public health with a cautious and safe approach to reopening, as safe as is possible given our current circumstances and given what we know about how COVID-19 spreads. And what we're really seeking to achieve is protecting the health of the residents of Toronto and, yes, businesses within Toronto, while at the same time thinking about how we move towards reopening in a fashion that allows for a sustainable reopening. The mayor commented that, in his conversations and certainly in the conversations that I've been party to with owners and operators of businesses, the notion of opening and closing and opening and closing again is one that is worse, the worst possible outcome in their minds. So again, it's about protecting public health and ensuring that we have a healthy people to support a healthy economy.
Jason, may I just say this? The framework was put together by the province. And I assume that there is a public health reason, and we have discussed it many times internally and with them and otherwise, as to why different kinds of businesses and enterprises were put in one category versus another. And a lot of that has to do with the personal contact that we've talked about throughout the pandemic that people have with one another in different settings as opposed to others. But make no mistake, I have great sympathy for those who are not able to open in part or in full because of the move to gray as opposed to some other color of zone. But my response to that is going to be to redouble my own efforts and redouble the efforts of all of us as a team here on vaccinations, on following public health advice, so that as soon as possible we can move to the next stage and more people can open. But if we do it too fast and we do it in an approach that is not cautious and careful with regard to the public health numbers, we will be very sorry that around the 1st of May or sometime like that, we'll be having to announce another lockdown, which I think most people, including those adversely affected as of this moment and who still wouldn't open under gray, those people would dislike that the most. And I think that that's what we're trying to avoid, but we are trying to continue to move forward.
Great, thanks, guys. On a separate matter, I wanted to follow up on the vaccination process in Toronto. We heard on Monday that it was complicated, more complicated in Toronto to set up vaccine clinics. But in Montreal, we talked about this with a number of people. There are people who are 70 and above who are already booking appointments, and our cities aren't all that far off as far as population goes and complexity. So I was wondering if somebody could explain why it's more complicated to set up vaccines for those 70 and over in Toronto versus Montreal.
It is complicated in the sense that simply on the basis of the size of the city of Toronto, and I certainly appreciate your context in comparison to Montreal. I think first and foremost, the important thing to keep in mind is we are vaccine availability limited at present. So before anything can happen, before anything can get underway, we require a substantial and consistent quantity of vaccine to be provided to us from the Government of Canada through the Province of Ontario. From there, we have put processes in place to ensure that we have an efficient and a seamless and as effective a means as possible for not only setting up and operating those clinics, but also in collaboration with our provincial partners for managing the registration process and all of the front end that is required in order to operate those clinics. During our proof of concept operations, we proved and validated that our clinic design works extremely well. It is very efficient, and our clinics are set up to, I would say, to output a significant, a high number of people on an hourly, a daily, and a weekly basis, while ensuring the highest standards of infection prevention and control, and while ensuring the highest standards of safety are in place. So I am confident that all of that is in place. The complexity at present is trying to manage all of that through the constraints associated with availability of vaccine, and just appreciating not only the size and scope of the City of Toronto, but the demographics and all of the challenges that go with operating any kind of initiative this big.
Brad, I'd just like to say a word on that. I'm not saying this to diminish Montreal in any way. It's a great city, and it's the second biggest city in Canada, but the population of Montreal, in fact, is just over half of that of Toronto. And if you look at probably any relevant basis of comparison, the number of shelter workers, the number of doctors, the number of medical workers in the city, I think you'll find the numbers are dramatically different. Those are the people under the provincial framework we had to look after first. But if you sweep all of this to one side, we had to look after those people first, and we have, and we're in the midst of doing that. It also is dependent, anything we might say about how we can speed up dealing with people 80 or 70 or 60 or 40 is going to be determined by vaccine supply at the end of the day.
Thank you, Mr. Mayor. We'll go next to Denise Peglinawan from the Canadian Press. Denise, go ahead.
Thank you. On Monday, I asked Dr. Davila and Chief Pegg about the vaccination of people over 80. You've said that it would remain based on the supply of vaccines. I was asking if you will be allowing pre-booking before March 15th. And now the Toronto Star reported this morning that it is available for pre-booking. I'm wondering if you can explain what happened there.
I can certainly start, and then Dr. Davila may wish to add. I want to be very clear, and I think it's important that we're very clear on this. There are no city-operated immunization clinics in operation as of present, and that is a direct result of not having vaccine available to us. The clinics that are operating are smaller clinics that are operating at the hands of our healthcare partners. I referenced today there are a number of those in operation today, and there are in fact vaccines being administered to a number of our residents over the age of 80, and like I said, the most recent data we have is that approximately 36,000 of those residents have already, or 36,000 doses, I should say, have been administered to our residents 80 years or over. A lot of that is happening in hospital and in hospital operated clinics in conjunction with those individuals arriving or having other business in the hospital that coincides with their ability to be vaccinated. As vaccine supply enhances and it becomes more readily available, and as I pointed out, the indication we have from the Government of Canada through the Province of Ontario is we are expecting that to be the situation towards the end of March, and then on a continuous basis on thereafter. Once we're in that situation where we have large quantities of vaccine available, we will operate at full capacity and do everything within our ability to make sure that everyone in our city who wishes to have a vaccine has the opportunity to be vaccinated as very quickly as possible.
So thanks, Chief. I think Chief Pegg covered most of the key points. If I had to summarize the whole thing, what I would say is that, one, we're grateful to our vaccination partners in the healthcare system for helping us out at this time. And what they are doing is undertaking vaccination right now in concert with the provincial prioritization framework and, in accordance with the available vaccine supply. So as the Chief rightfully pointed out, that does include some clients or patients who are in that 80+ category. At this point, given vaccine supply, the city clinics aren't operating, but I can tell you this, that we are looking forward to that opportunity when vaccine supply is plentiful enough that we're able to start really operating our city clinics, because we want nothing more than to get as many vaccines as possible in as efficient a manner as is possible into the arms of residents of Toronto, so that we can start to, imagine life a little bit more like it was before there was such a thing as COVID-19.
Thank you for that. So just to clarify, Toronto will not be pre-booking for 80 and over before March 15th.
To clarify, at this point in time, there is no opportunity to book into or to book appointments for a city-operated immunization clinic. That is correct. At such point as the online booking system has been made available and has been activated province-wide by the province, and once we have the relevant information relating to availability of vaccine that enables us to, with confidence, make appointments available, that process will absolutely be made available. But at this point, it is not. What I can assure everyone is that as very soon as we have that information, it will be widely communicated across all of our media and social media networks, and we will do our very best to make sure that that information is communicated clearly in multiple languages and is as very accessible as possible.
Okay, thank you, Chief. We'll go next to, David Ryder from the Toronto Star. Dave, go ahead.
Hi there. For whoever is best to handle this, it's been reported that Ontario is about to get 190,000 doses of AstraZeneca, and it's apparently arriving in Canada today or very soon. And it's being reported that it has an expiration date of April 2nd. I'm trying to understand how you're saying that we're not going to get a larger vaccine supply until the end of March. Can you tell us what's going on with AstraZeneca, and are you going to have a problem using it quickly enough?
Sure, I'll start, David. So I sit on the Provincial Vaccine Distribution Task Force. That is the team that General Hillier leads. I'm joined by a handful of my colleagues. And on a daily basis, we are updated, and the work is ongoing with respect to the provincial coordination of vaccine distribution. We were updated today. I also received the same information that you just made reference to. I also understand that there are incoming AstraZeneca vaccines into Canada and then accordingly into Ontario. It is the responsibility of the province of Ontario to determine the distribution and the administration plan for that specific vaccine, as with all vaccines. So the specifics as to where and how and when the province will distribute AstraZeneca lies with them, and we are at this point awaiting confirmation or awaiting the answers to those very questions as well. So candidly, David, best directed back to the province of Ontario, as it is their sole jurisdiction with respect to the allocation of those vaccines and the direction as to where they are distributed to.
Thank you. My follow-up is for Dr. Davila. Dr. Davila, do you agree with the province's science tables report that says a vaccine strategy that gives priority to the hardest hit postal codes will save more lives and curb the spread of the virus, rather than just doing it on a per capita basis?
So, David, with respect to the question, I admit I have not had the opportunity to fulsomely read the entire report, but I certainly have full confidence in that which the COVID-19 Science Advisory Table has, puts forward. I'm familiar with those who are at the table, and I am familiar with the methods that they would use. And my understanding is that that is their evidence-informed, advice or perspective on how best to provide vaccines. Certainly, that is also backed up by that which we've seen in other jurisdictions, that, a combination of age and geography in respect of those areas that are hardest hit provides for a very good way and for determining the allocation and distribution of vaccine in order to get to that objective of reducing spread of COVID-19 as much as possible. I would further say that, look, the more we get vaccine uptake across the broadest range of the population as quickly as possible, this is what will get us, to that place where we're all trying to get to. The lessening of the impact of the disease on our environment, and hopefully the restoration of life and conditions that are a little bit more like what we were used to before there was a COVID-19.
Thank you. We'll go next to Irby Khan from the Toronto Star. Irby, go ahead.
Hello, everyone. Good afternoon. Extending on what my colleague Denise Pagliano at Canadian Press said, and also David Ryder. This is a question for Dr. Davila, and Mayor Tory can also follow up on this. Some clients signed up and received vaccination appointments outside of their neighborhood hospital clinics by pre-registration in some areas of Toronto, and then their appointments subsequently got canceled. So I'm wondering, how will the city clearly outline in their guidelines, but where and how people in Toronto can sign up using the booking system on March 15th so their appointments are not canceled and all appointments can be optimized at city-operated clinics?
So I can start this off. The chief may actually have better insights to offer in respect of the booking system, but you've heard Chief Pegg comment thus far that we are awaiting, particularly for the city-operated clinics, the arrival of the provincial booking system, just given the nature and the scope of our operations. I think that really understanding the system is perhaps something that's best directed towards the province. We're looking forward to working with their provincial booking system, but obviously we're trying to provide an efficient system that doesn't give rise to cancellations and minimizes the amount of confusion, right? We're trying to get as many vaccines into as many arms as possible in as quick a time as is possible. That's fundamentally what we're all trying to do, and certainly we're trying to deploy the available technology and to use our resources in a way that actually gets us to that goal as fast as possible.
If I can just add to that, the province of Ontario is responsible for setting the conditions and the eligibility with respect to being vaccinated. And once those are set, those conditions will be set and programmed, if you will, into the eligibility assessment aspect of the tool. And then those eligibility verification components, as I stated in my remarks, will form the initial phase, or the initial, I guess, component of the registration process is probably the easiest way to say that. A quick example, it might be easier. So if, for example, the province continues, if it is age-based, there would be conditions set within the tool that would require the verification of someone's date of birth, for example, in order to determine their eligibility. And those list of criteria could really be endless and will happen at the discretion of the province of Ontario in accordance with the prioritization framework that they establish across the board through each of the phases.
Thank you.
A follow-up, Irby?
No, I don't have a follow-up.
Okay, thank you. We'll go next to Natalie Johnson from CTV News. Natalie, go ahead.
Hi, everyone. I'm curious to know what you think about some Toronto hospitals launching their own pre-registration websites for seniors 80 and up. These hospitals seem to think it's not wise to wait for the provincial portal to open on March 15th.
Again, I'm happy to start. So we are aware that some of our healthcare partners and some hospitals have launched their own internal or their own self-managed processes and websites and information consistent with that. I think it's important to note that, like we said, the City of Toronto, city-operated clinics are not happening. We also note, as we noted in the remarks, that there are a number of hospitals and a number of healthcare partners who are moving forward and who are vaccinating a number of people, including residents over the age of 80, from the supply of vaccine that they have. And as such, they have moved forward with the necessary registration processes to make that happen. Dr. Davila said it well. We're really proud of the work that our healthcare partners are doing, and we're honored to work in collaboration with them. And the fact that they are proactive and working hand in hand, not only with us, but with the province of Ontario to make sure that vaccine can be administered as effectively as possible and as expeditiously as possible, is something that I'm sure that we all applaud. So it is theirs. Ours will follow the very moment that we're able to activate our clinics when vaccine is available.
Thanks. And just as a follow-up, I understand that the supply isn't there just yet, but I wanted to ask whether, based on your forecasted levels of vaccine, whether there's any update to the target date on when seniors 80 and up can start getting it from the city clinics.
The most recent update is, as I said, that we are still expecting to see significantly increased volumes of vaccine provided by the Government of Canada through the province and then into the City of Toronto. We expect that to happen in late March. I think we can all appreciate that when you're dealing with not only two levels of government, but supply chains operating between the two of them, there is some variability in that supply chain. So the best we have right now and that we're planning on is the arrival of significantly increased quantities in late March, and that times absolutely times well with what our planning assumptions have been, and we will be ready to go. As we have, my commitment to Mayor Tory and to the city and to the city manager and each of you really has been from the start, our plans are nimble, they are scalable, and in the event that something were to change that would permit us to go sooner, we will be prepared and we would respond as very quickly as possible. But at this point in time, indication is that incoming vaccine quantity the end of March with operations to get underway very shortly thereafter.
Thank you. We'll go next to Miriam Medahaya from Radio Canada. Miriam, go ahead, please. Just need to unmute yourself there, Miriam.
Thank you for the reminder.
There you go.
Hi, thank you. So this is for Mayor Tory or anyone else who wants to chime in. So Justin Trudeau is optimistic that all Canadians who want to be vaccinated can be earlier than September. Based on what you know and what you see on the ground and the current speed of Toronto's vaccination plan, do you believe it's possible for Canadians in Toronto?
I will just start off simply by saying, repeating the words the Chief just spoke. We believe that our plans have been carefully enough put together, starting before there even was a vaccine, that the network of clinics established by us, working with healthcare partners in the province, is going to be robust and big enough that if the supply comes at a rate in excess of what has been predicted, we based our timetable in terms of when these clinics would open and so on, largely on the supply of vaccine. Because we're hiring people, have been for some time. We've established locations, got them leased up. In some cases, they're completely furnished and ready to open the door. The one important thing that's missing is vaccine, followed by a scheduling and booking system. Those are both on the horizon. So the Prime Minister probably would know more about the supply of vaccine than many other people, but we'll be ready to respond and to do even better than our current schedules project if the supply is there and if the booking system is up and running.
And my follow-up question is perhaps for Matthew Pegg or Dr. Eileen Davila. We can expect a delay of 4 months between the administration of the first and second dose to be recommended by the National Immunization Committee. At first, I wonder if this is good news for Toronto. Does it complicate things? And how much will it accelerate the vaccination plan?
So let me start off with that one. First and foremost, I think that, any public health person will tell you that there is always a little extra complication when you're talking about a vaccine that requires 2 doses. So that's just a fact as it is. And this is the case for most of the vaccines, certainly the vaccines that are licensed for use in Canada for COVID-19 currently are all 2-dose vaccines. So there's always that little wrinkle there. That being said, the idea of being able to delay the second dose or to increase the interval between that first dose and the second dose, given the current supply issues, would allow for a greater number of people to be covered up front by that first dose, rather than having to, make sure that there are supplies held back or held available for second doses that need to be given within a tighter timeline. So there's no question that there's some benefit to that, and certainly that has been the science that has emerged as more and more people have received vaccine all over the world. This is an example of the use of the best available evidence from around the world to help inform our actions here. So certainly very, very happy to see that. But I would also say this, because it's the theme of today, and you've heard each of us say it thus far. The more the supply is available, the easier it is for us, regardless of what the interval is between the dosing, to actually get the coverage that we need and to offer that protection to as many people as possible as quickly as possible. So no question, there's some advantage, but supply is absolutely the current issue of the day.
Perhaps what I can add is just to acknowledge that very clearly things like dosage intervals those are decisions that are made by duly qualified medical doctors and medical practitioners. From a practical logistics standpoint and the deployment of our plans, our processes that have been put in place to build and assemble all of our response protocols and all of our clinic operations have been engineered in order to be readily flexible in response to changes like that. So to answer your question directly, I have no concerns that it complicates our operations. It would simply require some behind the scenes or some back end programming changes with respect to the second dosage intervals. We would make those changes and proceed accordingly. And like Dr. Davila said, if that results in more people being able to be vaccinated more quickly, it brings a smile to my face.
Okay, thank you. Our final question is to Laura Stone from the Globe and Mail. Laura, go ahead, please. Just have to unmute yourself there, Laura. There you go.
Hi there. Thank you so much. Mayor Tory, I'm looking for your reaction to the release from the Canadian Federation of Independent Business today, talking about Toronto having been in the lockdown, as they say, for the longest jurisdiction in North America. How do you justify this? What do you say to businesses who have been waiting for months to reopen? Now you're slightly reopening if the province listens to your advice. What do you say to those businesses that have struggled throughout this time? And what do you say to your detractors and critics who have essentially accused you of doing irreversible damage to the soul and character of Toronto?
That's a kind of a question with many different elements to it, but the first thing I will say is that Dr. Davila and I had a very excellent meeting with the people from the Canadian Federation of Independent Business and discussed with them the possibilities, including the recommendation that we're making today, that we move to the gray zone. And while they would like to see more businesses reopened faster, I think they understood the situation that we've found ourselves in, where the health crisis we faced in Toronto was more acute than in many other places, and the City of Toronto is different. It's an entity that is different than any other one in the entire country in terms of the size of the population, the density of the population, some of the socioeconomic factors that have led to, to a very, very serious health situation. And to my detractors and critics, first of all, I mean, you have those no matter what you do in this business, so I'm quite accustomed to that. And you just have to satisfy yourself based on the best expert advice you can get and all the considerations I mentioned. The impact on business and the economy, what's going on in the rest of the region and the rest of the province, the mindset of the public, but most importantly, public health considerations, that you are doing the right thing. And I'm really incredibly sympathetic to the toll this has taken on businesses, both in Toronto and elsewhere, the effects of the lockdown. But I think many of those same businesses, as much of a struggle as it has been and as it is, and in some cases will continue to be, they would not thank any of us if we had moved sooner than today or even today, and it turned out to be a move that lacked in the appropriate caution that led to a further lockdown a month or 6 weeks or 8 weeks from now. Nobody wants that. And that includes the people, and I don't want to put words in their mouth, that we talked to at the Federation of Independent Business. So I'm really, really sympathetic to what has gone on. I am very grateful that the governments have moved to have, I think, fairly effective programs of relief and assistance and support for those businesses. But I know the most important thing they need to do is to get their doors open again and get back in business. And we are going about trying to do the right thing to make sure when they get back in business, they can stay in business. And I think that that is what most of them would opt for. And we're accountable for the judgments that we make in the end. And I'm not saying that in any way that, suggests that that's going to fix the business problems, but we're accountable. So you stand or fall in the decisions you make, whatever your detractors or supporters have to say.
And Dr. Davila, I was hoping to ask you, a couple of weeks ago, you essentially said you're more concerned than you've ever been. What has happened over the past 2 weeks to change your mind in the respect of allowing Toronto back into the framework? Has that not panned out as badly as you thought it would be? And what is it about the data that tells you that Toronto cannot reopen even further than you're recommending today?
Well, Laura, when I look at our case counts relative to where they were a couple of weeks ago, we are seeing, some declines and some signs for cautious optimism. And for that, I'm grateful, right? This is exactly what we want. We want to see case counts going down. We want to see fewer hospitalizations and fewer outbreaks in our institutions. This is exactly where we want to go. My caution here is that we continue to have variants of concern emerging in our environment. And we know from science and from the experience of other jurisdictions that these variants of concern are associated with heightened transmissibility. The plus side is that the measures that we have been using to date, the distancing, the mask wearing, the hand washing, these kinds of things do make a difference in terms of controlling the spread, even of these new variants of concern, despite their heightened level of transmissibility. So it's a question of how do we continue to maintain the progress that we've seen to date, and to ensure that we have that opportunity to make these steps towards more flexibility in our daily lives, but do it in a way that we don't lose or squander the progress that we've made. That's really what this is about at this time. So that's why, I bring this with a little bit of caution to it to say that, look, our data suggests we can move in this way, but we should not take that for granted. We need to continue to be careful and vigilant. We know what makes a difference in terms of reducing the spread of COVID-19, and that is trying to keep our distance to the greatest extent possible, wherever possible, for those where that is an opportunity, and it is a possibility.
Thank you very much for joining us. That concludes today's briefing. Our next scheduled briefing will be this Monday, March the 8th at 2 p.m. Please stay well.